what you really wanted, you gotta be it. As Ms.Blue has shared with the world, it's all about frequency. If you feel it, show it. If you want it, grow it. If you believe it, know it. It's all about frequency. If you dream it, live it. If you receive it, give it. Nothing's missing, I'm it. It's all about frequency. In the past, I thought I lost it, but the truth was always near. Every scar became a teacher. Every fall just brought me here. Now I'm rising with the healing. Every light inside of me. Not becoming what I'm chasing. I am the frequency. If you feel it, show it. If you want it, grow it. If you believe it, know it. It's all about frequency. If you dream it, live it. If you receive it, give it. Nothing's missing, I'm it. It's all about frequency.
Ask the question, how is this possible? The answer subtle, synchronicities audible. Keys unlocking, belief expanding. Frame by frame, new life commanding. No chase, no match. I embody the key, the light I own unlocks destiny. Raise my vibration, reality shifts. Every dream I desire already exists.
Nothing's coming to me. No, no, it's already here. When I raise my vibration, the vision is clear. The vision is clear. It's already here. Raise my vibration, the vision is clear. Believe it, know it. It's all about frequency. If you dream it, live it. If you receive it, give it. Nothing's missing, I'm it. It's all about frequency. It's all about frequency.
Oh my goodness. Peace and greetings, everyone. Welcome, 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 welcome on in. How is everyone feeling? How are you doing? Definitely got to let us know where you're tuning in from. I want to welcome everyone on into the platform on this, well, where I am broadcasting from in the world on this Saturday evening. Wow. How are you all doing? How are you all feeling? I have a special, special treat for us tonight. And yeah, you guys are tuning in from all over the world. Excited for the conversation. Yes, this is going to be one for the records. And yeah, we got a lot of things that we're going to cover. So I want to welcome everyone on in as we get ready to get settled and welcome our guests on. Dr.Kris is going to be joining me, and you're going to be finding out so much about her and the amazing and wonderful work that she's been doing in the world and sharing it with everyone here. So let me know where you're tuning in from, like what city, what state, what country, even what continent you are tuning in from around the world. And I just want to welcome you all in. I am Ms.Blue, the visionary psychic medium, and I'm going to be your host for the next hour as we dive into this much needed conversation that we're going to be talking about here. So I want to welcome the Soul family in the building. I also want to welcome on in all of the visionaries as well. And if you're new here and this is your very first time tuning in, definitely let us know. And let me be the first to say welcome and thank you so much for joining us here tonight. Yeah, yeah. Now, we're going to be diving in tonight. And one of the things I want you all to know that even though this conversation is going to be centered around those things that is connected with the feminine, right? With women and their bodies and their health, I want to encourage you to for the brothers in the building and the men for you to come on in because I think you're going to get some gems. Oh, you're going to get some gems tonight that might just blow your mind, right? And it's literally can change the way that you see birth, woman's health, your own health, and life completely again. So I know that's a big claim, but we're going to talk about the forgotten truths about birth and what women aren't told. Yeah, yeah. So I'm so excited. Everyone in the building from Chicago to New Jersey in the building. We got North Carolina in the building. We also have let me see if we can say this. Moritan, more, Moritan, yes, in the building. Good to see you, Carolyn, joining us from way over there. And we got Chicago in the building. Shouts out. You guys had some weather come your way as well. So I just want to welcome everyone on in. We're going to dive into it. Now, one of the things I will tell you that we're going to be talking about tonight, and I just want to kind of put this important note. I want you to know that the conversation that we're going to be having, this is a educational conversation and it's an exploratory one, right? It's not intended to replace your personalized medical advice. So wherever you get that help from, that is there. So I want you to also understand that you should really consult with your healthcare and professional providers regarding your pregnancy, your birth, your postpartum health, things to do with your pelvic floor concern, and even when it comes to issues and things surrounding placenta. Because that's going to be kind of one of those topics we're going to dive into deep. And I was so fascinated, connecting with Dr.Kris. And within a couple of minutes of having a conversation with her, and me thinking back to even when I gave birth to my children and some of the things that I actually was struggling with, and some of the things that I was trying to understand. Like she instantly, without even knowing it, she answered those questions so profoundly. So I know tonight this is an important conversation. So you guys, and send the invites out, invite those people over, and pay attention because we're going to be diving in. And so again, I ah yeah. Uh-huh. Uh-huh. And you guys are saying my volume is low. Let's see if we can fix some of these things that are going on, okay? I'm going to see if I can fix some of these things that's happening with volume, some of these things that are going on here. And I want to make sure, hmm, I want to make sure that you guys can hear me loud and clear. So let's see. Let's see if we can make sure the volume is up good and you all can hear me. I don't know if it'll let me. So give me. All right. Let's see if that's any better. Let's see if the volume is up. Let's see if that's a little bit better. If we're a little bit better on the volume. Okay, some of you guys are saying the volume is perfect. I'm going to make sure that I turn me up and Dr.Kris up. So as we're coming on. So thank you guys. A lot of energy just going through the atmosphere. So we're going to work with what we got, you guys. And in the hopes that we can get this volume thing together. Hopefully that's better. So again, I want to welcome you in. I am Ms.Blue, the Soulful Oracle, and tonight we're going to be starting this conversation that has been long overdue. I want you to know that there were things that women are taught about pregnancy and birth, and then there are things that women discover that happens only after we go through the pain or we have the issues with the leaking or even the back problems, the discomfort, and a lot of fear and a lot of confusion. I know that certainly happened to me when I gave birth as well. And even sometimes feeling that something inside their body has changed and no one fully could explain that to us. And so, one of the things that we're going to be exploring and speaking about is that we're going to be talking about what women are never told. And we're going to discuss something that I don't know if you all have thought about it, but it's one of those things that is really significant to women's health, and that is pelvic health. And we're going to be talking about that. Dr. Kris is going to talk about that. We're going to talk about pregnancy, birth, postpartum healing, the powerful role of a birth doula. Ooh, yeah. I know we got a lot of doulas in the soul family, and Dr. Kris is going to be talking about the role of the birth doula. We're going to be talking about the placenta, and you're going to see some incredible things about the placenta and even the work that I think is quite revolutionary in this time that Dr. Kris is a part of when it comes to placenta. We're going to talk about it from a cultural perspective, ancestor and traditions surrounding the placenta. And this, I think, is something we don't talk about enough. We're going to talk about the role of the father and the patterns in the birth process. Yeah, yeah. And we're going to be exploring the divine feminine and divine masculine, not as some sort of competing force, but the energies that come together in a conscious creation. In a support role, we're going to be talking about protection, healing, and birth. And so let's get into it. So I am so excited to introduce you all to Dr. Kris. And that's what we're going to be doing. She is going to be our guest tonight. She is someone who is a profession who professionally works and is deeply personal. Her own experiences as well. She'll be sharing those. So I want you all, please, to welcome Dr. Kris Merchant, all right? Who we will be calling and addressing tonight as Dr. Kris, Dr. Kristen. Let's welcome her on up.
Hello.
Welcome on in. Greetings, Dr. Kris. How are you doing?
I'm well. How are you?
I'm doing well. Good to have you here. Everybody is so
Yes.
excited for the conversation that we're going to be having here tonight. And we're going to get into this. And, I wanted to tell a little bit more about you. She is a mother of two boys, and they may be joining us too indirectly here tonight. So no worries, everyone.
If you hear screaming, they're okay.
Is there okay?
They're okay.
What you say? All is well. So, these are some of the things that we're going to talk. But before we get ready to start talking about your credentials, Dr. Kris, and everything that you do professionally, I really want to kind of tap in with you and see how are you feeling as you enter this conversation here tonight.
We've talked about this, that I'm doing it scared. So the butterflies are going, but it's good.
Mm-hmm, mm-hmm, mm-hmm. That's good. That's good. So I love it. All right. So now we're going to get into this, and then I think it'll be good to come back and talk a little bit more about your professional experiences and all of those things. But
Mm.
I want to talk about this. I want you to um, tell us about the first pregnancy that sort of changed your direction in your life? I think this is a great question for us to anchor because you do so much in this space when it comes to women's health. And there are particular areas that you are more concerned with than others. So let's talk about that.
So, as Miss Blue said, I have two boys. My first pregnancy, At 28 weeks, I was diagnosed with severe preeclampsia.
Mm.
Blood pressure was 189 over 110. And by the time they rushed me to labor and delivery triage from the clinic, my protein levels were 7 times the normal limit. I was admitted into the hospital, given 2 courses of steroids to prevent seizures.
Wow.
And my first son was born at 29 weeks.
Mm.
Spent 9 weeks in the hospital, in the NICU before coming home. So that experience led me towards women's health advocacy,
Yeah.
especially in that realm.
Yeah.
Yeah.
That's powerful in itself. And can you explain to someone who perhaps maybe don't know what preeclampsia is? Like, what is that when
Yeah.
someone has that?
So preeclampsia is a full body system of just it affects every organ in the body. Preeclampsia being pre, and then eclampsia meaning severe seizures that can lead to death.
Mm.
And so it's marked by high blood pressure, high protein count in the
Mm-hmm.
urine. Um, and some of the signs and symptoms are
Mm-hmm.
visual disturbances, profound swelling in your face, hands, and feet,
Mm-hmm.
um, abdominal pain, particularly that on the, I believe on the left side, that doesn't, it's not like normal, like, oh, I'm pregnant pain. It's not a
Mm-hmm.
Braxton Hicks. It's very different.
Yeah.
Um, and there's some others that aren't coming to my mind right now. But
Yeah.
the issue with the signs and symptoms of it is that it mirrors regular pregnancy signs and
Ah.
symptoms. So a lot of people don't recognize it right away, or they brush it off, which was something that happened to me. I was having the signs and symptoms leading up to that prenatal appointment that I went to. And every
Mm.
time I called labor and delivery or the nurse advice line, I was given, oh, you have history of migraines with aura. So just take it
Mm.
easy, rest. You're doing too
Wow.
much. It's just stress. And lo and behold, it was
Preeclampsia.
building to the
Wow.
point that it got to.
Wow.
Yeah.
And so this is a life-threatening condition that
Yes.
you can pass from this. Mothers can pass from it, and I'm sure mothers
Yes.
have passed from it.
Yes, very
Wow.
much so. It's
Wow.
responsible for it's prevalent in about 12% of all births, and it's responsible for 500. I'm trying to think of the exact number. 575,000 uh,
Wow.
infant deaths per year.
Mhm.
So
Wow.
yeah.
Wow. Yeah, that is. And so would you say that during that particular season, once you came out of that, what did that reveal to you about the gaps when it came to women and their care?
That is such a loaded question. Because there are so many different gaps that I noted.
Mm-hmm.
One being just the lack of
Mm-hmm.
information that's given to pregnant women. It's my first
Mm,
time being pregnant. I'm in the medical field at the time,
mm-hmm.
and I had heard of preeclampsia.
Right.
Um, it wasn't something that was drilled in like this is what you need to look out for, even from my own providers.
Wow.
And then even jumping ahead a little bit, even leading into my second pregnancy, going back to the same OB provider,
Mm-hmm.
and the only um, course of prevention that she gave me was take this baby aspirin from 12 weeks to 32 weeks. And I said, that's
Wow.
it? Like, that's all we're going to do? we we know that
Wow.
I had a severe case of this before, and all we're going to do is give me baby aspirin, nothing else. I
Mm.
fired her. I went to someone else.
Someone else. Yes. Oh my goodness.
um, but which is something that I tell people, like, if you don't feel comfortable with your medical provider for any reason, you can fire them. Go to
Yes.
someone else.
Yes.
um, and I definitely felt more heard with my new provider,
Mm-hmm.
and she gave me um, supplements that I could take, lifestyle changes that I could make, etc., to help manage the course throughout the pregnancy.
Yes.
Um, but even just with all of the different symptoms that women experience during pregnancy, everything's blamed on hormones, literally
Yes.
everything.
Mm-hmm.
And so
Mm-hmm.
um, they don't give you real concrete advice on what you can do um, to mitigate that,
Mm.
because they're just like, oh, it's common, it's the hormones, it'll pass.
Mm.
And that goes through your pregnancy into your postpartum, which postpartum they're now recognizing as 2 years
Yes.
for
And
being in the
mm-hmm.
postpartum window, but it's really for life. Like, you, once you've
Wow.
had a baby, you were postpartum for life, but they don't recognize that yet. But science is recognizing the 2 years.
Wow.
And so
So
you,
hold on a
yeah,
minute, Dr. Chris, because you just said something so profound. I'm sitting here like, wait a minute, did I hear you correctly? So the window for postpartum that now is being recognized, because I think before, probably when I had my kids, it was 6 or 7 months or to a year. But they did move that to 2 years to say that
mhm,
you could be going through, for lack of a better word, the postpartum blues for
mhm,
2 years. But
mhm.
you're saying in your work, in your findings, you realize that you can be postpartum for life?
Because there are changes that happen in your body that essentially never really return to your pre-postpartum self.
Mm. And you're not just talking about aesthetic body. You're talking
Correct.
about your chemical, your subatomical particles, your
Yes.
organs in your
Mhm.
body. Can
Yes.
you give us an example of some of the things that you've seen in your line of work and working with women that can happen, that can change who you are at a biological level for life?
When, so coming from the pelvic floor perspective,
Mm-hmm.
um, one thing that's kind of talked about is, oh, you have a baby and then you leak a little afterwards, and
Right.
they just like normalize that, like, oh, that's just something that happens.
Mm-hmm.
um and it's not necessarily the act of having a baby, like physically delivering the baby, that is causing that. When you think about carrying the weight of the baby, the weight of the placenta, the increase in your body fluids
Mm-hmm.
throughout that 40-week period, give or take, that pressure sitting down into the pelvic floor, pushing up against your bladder, pushing up
Mm-hmm.
against your rectum.
Wow.
It changes the way that your bowels move, that gut biome, that whole process. Um, that's where you see changes. So you see like increase in constipation. You're seeing increase in bladder urgency and frequency. And sometimes those things don't revert back once you've actually delivered the baby.
So they
So
don't
I'm seeing
revert back.
clients who are in their 60s and 70s who are still having issues that they never, because it wasn't pushed like, oh, you should, see someone about your pelvic floor, during that time period where they were having kids 30, 40 years ago. So now they are, in their 60s, 70s, close to 80s, still experiencing, those difficulties.
Mm, mm-hmm. Mm. Oh, wow. Oh, wow. Okay. I was working on the sound where you were checking that just to make sure, but that is like I never thought about that. Like sometimes because I know for myself there are certain things that I know my body it operates different, like completely different. Never has returned. So that's yeah, that's a that's a mind-blowing fact. I didn't mean to cut you off, but I really wanted us to dive into that to really hear what you were saying that you may be postpartum for the rest of your life. And so when we think about what postpartum means, can you give us a healthy definition so we can really understand that? Because I think a lot of times we stop at just the emotional component of it. Now we've brought in some of the things with the physical body, but what does it truly mean to have postpartum? Mm-hmm.
To have post, oh, sorry, there's
Is it you're getting an echo?
let me see, does that, no, I'm still getting it.
Hold on. Let me try to do my magic over here. Give me a second. Yeah, okay. So that's not it. See if that's better now.
Hello.
Yes, is that better?
No, it's like a delayed echo.
It's a delayed echo. Okay, hold on a second. What about now?
Hello.
Yes.
That's much better. Yes.
That's better? Okay,
Yes.
perfect. Hopefully it's better for them too. We're going to work out the logistics, but trust me, nothing is going to stop this conversation. It's just too good. But yeah, talk to us about a healthy understanding of what postpartum means. So people can really just get a full, like a more holistic understanding of it.
So from the physical side, the medical side, you're looking at, body changes, breast changes, pelvic health changes, hormonal changes. You're having this drastic, drop in progesterone, and estrogen. They're both kind of plummeting, immediately after the delivery of the baby.
Mm,
Um, you're having memory changes that actually start during pregnancy. um, you are, um, energy levels have dipped.
yeah.
So from a physical point, and then when you think about spiritually,
Hmm.
we've literally brought portal a life from one end to the other. So we've opened this portal,
Yeah.
which essentially just changes how we think, how we feel, how we address things,
Mm,
um, and that
wow.
stays with you.
Yeah. Yeah. Stays with you forever. Forever. Powerful. Powerful. Wow. Definitely we are we are definitely learning a lot here tonight when it comes to that. Now, I want to ask you this. I guess we kind of touched on this, but I kind of wanted to know, you know, well, we'll come back to that because that's a little different. But I want to get into this because you touched on another area that I want us to dive into, and this is one of your areas of expertise, and that is when it comes to pelvic health. And I want to talk about what you experience personally and also what have you been noticing about pelvic health because it's not really talked about. I mean, am I wrong, Dr. Chris? But this isn't something that's talked about outside of, yes, get your exams, and we just want to make sure you don't have, any kind of things going on, issues to address, or if you're getting ready to give birth. But pelvic health, let's talk about the significance of that health. Yeah.
I don't know how to condense this.
Don't condense it. Don't condense it. Listen.
Um, okay. So where do I start? So as far as just in general,
Mm-hmm.
our pelvic floor is responsible for the 5 S's. So sexual function, sump pump, which is basically pumping fluid from the bottom half of our body up towards the heart.
Mm-hmm.
For sphincteric function, so holding our poop and pee in. For support,
Mm-hmm.
so holding in our organs. So for the female, our uterus, our bladder, and our rectum. And I'm missing an S. It'll come to me later.
Mm-hmm.
Um, so it's pretty important.
Yes.
And so when we look at outside of the pregnant body, it holds those functions.
Yes.
Um, you can be a child and have pelvic floor issues. You can be a woman and have pelvic floor issues. You can be a man and have pelvic floor issues.
Wait a
Everyone has a
minute.
pelvic
Wait a
floor.
minute. Wait a minute. We got to stop. We got to stop. Say that again. So you can be a child and have pelvic floor issues. You can be a
Mhm.
man and have pelvic floor issues.
Yes.
Because am I wrong? But isn't this something that they usually kind of tailor just towards women?
Mhm.
But this could be impacting men.
Mhm.
This could be impacting children.
Mhm.
Okay, you got my ear. I'm listening. All right, let's go.
Um, so I personally don't treat children, and I don't treat men because my focus is in the pregnancy postpartum realm.
Yes.
Um, but there
Mhm.
are pelvic health therapists who treat children, and there are those who treat men.
Mhm.
Men actually, um, there's really a void in that
Yeah.
area because there's a stigma attached to it for men, like, oh no, nothing's wrong with me, I don't need to go get that checked out, I'm fine, etc. But I've noticed when I talk to my colleagues who do treat men,
Mhm.
uh, that when a man finally gets to them, all that
Mhm.
stigma is gone. They're like, nope, I don't care what anyone thinks about it. I need help. I need you to
Right.
help me. And they're receptive to it
More
at that point.
receptive. So,
Right.
what are some of the symptoms before you go a little further of the pelvic floor that someone may be experiencing, but maybe don't have a clue to what's going on with within their body?
hmm Pain is a big one.
Hmm.
So when we think about vulvodynia, so pain to the vulva area,
Hmm.
vestibular dynia, pain inside of the vestibule.
Hmm.
Hold on, I have my little.
Oh, you have a
So,
dot? Okay,
so in the
yes,
vulva,
we're getting educated tonight, y'all. Yeah.
so around the vulva, so that's the skin, the outside that we're looking at. The vestibule is going to be within the lining of the labia.
Mm-hmm.
Um, and then you look at pain with sex, pain
Mm-hmm.
with any type of insertion. So if you're having pain with inserting a tampon, if you're having pain with inserting a speculum for a gynecological exam,
Mm-hmm.
those are big ones. Back pain, hip pain, um, are can be attributed to pelvic floor dysfunction.
Mm-hmm.
Um, uh, uh, incontinence,
Mm-hmm.
of both bladder and bowel, so leaking in both areas, that's pelvic floor dysfunction,
Mm-hmm.
constipation, difficulties starting your stream, like, hey, I really have to urinate right now,
Mm-hmm.
but I sit down and I can't get anything to come out. Pelvic floor
Mm.
dysfunction, constipation, pelvic floor dysfunction. Um, what else? Uh, Endometriosis, pelvic floor
Oh,
dysfunction,
wow.
um, PMOS, which the name just changed. It used to be
Change. Yes.
PCOS,
Yes.
pelvic floor dysfunction. It's a metabolic dysfunction, but it affects the pelvic floor. Um, oh gosh, there's so much.
Mm. Wow.
I'm trying to think.
Mm-hmm.
There's a whole list.
I see. And, the crazy thing is when it comes to that, normally would associate the pelvic floor with a woman. But just to know, I think for people who are parents and sometimes, issues with children, that is something we need to be aware of.
Yeah.
Is there something that caused this? Is there a known cause for some sort of pelvic floor dysfunction? Like, is there a cause?
There can always be like events, traumas that have occurred.
Mm-hmm.
As far as like when you think about children
Mm-hmm.
normally children pelvic floor dysfunction is like they're constantly wetting the bed, even though they're an older child, even sometimes teenagers, uh, bowel
Wow.
disturbances, this constant constipation or whatnot. Sometimes um, children are bedwetting, and so you're thinking it's a leaking issue, when really
It's the pelvic
it's
floor.
it's the constipation. So they're
Oh,
so constipated, they're so backed up that
wow.
it's just allowing this leaking and this overflow that's occurring. So there's there's always a root cause to something,
Mm-hmm.
but it just depends on what you're looking at. Going back to endometriosis,
Yes.
there are some speculations that potentially it is happening in utero because they're finding endometrial cells
Mm-hmm.
um, in brain tissue. How
Wow.
is it getting from down there to up there if it didn't
Wow.
happen congenitally? So,
Mm. Mm. Wow. Yeah. That's kind of mind blowing. And for men, what would you say? Like some of the same things could be some sort of trauma that happened as well too.
could be trauma, could also be uh, like muscular dysfunction.
Mm-hmm.
There's a hip muscle, it's an internal rotator that's um, a small muscle,
Mm-hmm.
um, but it's really deep behind the glutes.
Mm-hmm.
So externally, it's pretty hard to touch it and assess it.
Yes.
But you can find it really easily when you go inside and
Mm. Yeah.
through the pelvic floor muscles. And so it's kind of anytime you have muscles that are very close to each other, even though they do different things,
Mm-hmm.
they act on one another.
Wow.
So if you're having hip issues, you can also be having pelvic floor issues. If you're having feet issues because of the fascia connections,
Mm.
you can be having pelvic floor issues, jaw
Okay.
issues.
You hit on something. You said if you're having feet issues.
Mhm.
So, what kind of issues with your feet? I know the fascia, and correct me if I'm wrong, Dr. Kris, that fascia runs from the feet all the way up to the face and the jawline,
Mhm.
right? It goes through the
Yes.
pelvic floor and it goes all the way up and to the
Mhm.
face and the jawline.
Mhm.
So, if you're a man, woman, or I guess we can say child, right?
Mhm.
But if you have problems with your feet,
Mhm.
What kind of problems? Like you are
Like
flat footed, or it's hard for you to walk, or you get tired, or your
flat
toes. Mm-hmm.
flat-footed, plantar fasciitis,
Mm-hmm.
um, just tight tension, tightness,
Mm-hmm.
regardless. It doesn't have to be something serious. Just having tension in those muscles in the
Mm.
feet can lead to tension and tightness in the pelvic floor.
Wow. That's good to know. That is amazing to know. So, um, wow. I'm kind of lost. I'm kind of stuck right there. Like, wait a minute. Okay, let
That's
me
why I
back.
said there's so much. I don't I don't know where to go.
No, no, no. This is perfect because we need to know about that. And even when it comes to, and forgive me, I still call it PCOS, but I know they just recently changed the name.
Mhm.
Even that being connected to, well, endometriosis being connected to, the pelvic floor and how that plays such a significant role into everything. Now, when we're looking at the body, just in general, the pelvic itself, that pelvic bone, right,
Mhm.
is also similar to the cranial, correct? Or to the brain? How do they connect? Isn't it another portion of the body that's kind of similar to that? Am I getting that wrong?
So the bones themselves, I wouldn't say are necessarily similar.
Mm-hmm.
There are multiple bones that are fused together that create the pelvic girdle.
Yes.
Um, but I would say more if we're talking about similarities in how things look.
Yes.
The pelvic floor muscles uh, strongly resemble the vocal cords.
Oh, okay. Okay. Wow. Sometimes I talk, I do feel that vibration. I do, I literally do feel it.
So, one thing, and I bring this up when I'm working with women for birth prep,
Mm,
because we want our pelvic floor muscles to be as relaxed as possible during the pushing phase. We want those
mm-hmm,
muscles to not be tensed up because that tension is going to
mm-hmm,
create a resistance as baby is trying to make their way down the birth canal.
mm-hmm,
Um, One way to allow some relaxation into those muscles
mm-hmm,
is to activate like a low guttural sound
mm,
versus a high pitched sound.
mm.
So, and I tell the same thing to people when they're working on defecating and there's like some constipation there. Use your squatty potty, but
Yes.
also activate that low guttural sound. Like I tell my kids to do it, and they think it's fun. Um, I tell them to moo. I don't tell pregnant women to moo, but I tell my kids to moo when they're
Right.
pooping, and it helps relax so that they can get
Yeah.
the poop
Well,
out.
two things you said I love. One, I have a squatty potty. I do have one, and I have one in my guest bathrooms as well. You know, I want to talk about the low sound. Can you give us an example of what that sounds like?
So like a low vibrational versus
Um,
mhm.
mhm.
And if you do that, you feel like your pelvic floor kind of open a little bit,
Mhm. Mhm.
especially if you're a woman, you feel that kind of purting down there.
Yeah.
Versus if you do like a you
Yeah.
feel your pelvic floor tense up and tighten when you
Ah,
do that.
I got you. I got you. And so for men, what would you recommend to do the low moo sound as well too?
For pooping, yeah. If
Mhm.
they're having trouble getting it out, yep.
Mhm. To
Relax
do
those muscles.
Yeah, to do the moo sound.
hmm
And when you say moo sound, can you give us an example of what that
Moo. Like literally get into it.
Just like it sounds, huh?
Just like it sounds,
Moo.
moo. But you feel the vibration when you
Yes,
do
you
that.
do. You
Yeah.
do. You really do. You really do. Fascinating information. We do have a question, and I think it's one that I want to talk about because it's one that I was told that I had. I was told, and here is the question also that's coming from chat, is about a tilted pelvis,
Hmm.
pelvic. And I had a tilted, or told I was had a tilted pelvic.
Hmm.
How does that happen? Because that was a question I didn't really get the answer like completely, like how it happened. Was I born with it? What's the dealio? But what is that?
Okay, so there's two ways to look at that.
Mm-hmm.
The way that I was taught in school
Mm-hmm.
is that you're if you're having like a anterior tilt, um,
Mm-hmm.
it's too far away. I'm not going to grab it.
Okay. Okay.
But if you're having an anterior tilt,
Mm-hmm.
that there's basically a tightening or gripping of the posterior chain of the
Mm-hmm.
muscles. So thinking about glute tightness,
Mm-hmm.
um, not being able to get good lengthening through the glute muscles,
Mm-hmm.
tension, tightness in the pelvic floor as well.
Mm-hmm.
Um, and then I got into practice, and
Ah.
I um, noticed
Mm-hmm.
that people, particularly Black women,
Mm-hmm.
melanated women, more curvier women, um, are told that they have this tilted pelvis,
Hmm.
and it's really just their anatomy because there's no tension in the glutes.
Wow.
There's no tension in their pelvic floor, but they still have that kind of tilt to it. Um,
Wow.
so I try not to treat everyone the same. I really want to look to see, like, is there really muscular dysfunction that's causing
Mm-hmm.
this structural change,
Mm-hmm.
or is this just how your anatomy is?
Now, that's interesting. So I want to go back because you said you noticed when you were working with particularly women of color, particularly African Black women,
Mhm,
you noticed that that's just their normal anatomy.
mhm,
It wasn't anything wrong or anything different. So
mhm.
this could be one of those cases where the doctors who were diagnosing or suggesting this was what they just weren't used to treating women of color. Get
Correct.
out.
Yeah.
Wow. Because I'm a share why this is significant. Because I was told after I had my son that because of my tilted uterus, I probably would not be able to have any more children. Well, of course, that's not true. I had my daughter. But really, I had one physician that was um, my PC that was really like, she was so concerned, my OBGYN, and she was saying, oh, you need surgery to correct this. And, they were going in like, oh, your uterus is tilted and this could cause you so much problems later and yada, yada, yada. And something inside of me just said, no, I didn't really have any other kind of reason. There was nothing else wrong with me. Like there was no other kind of, immediate concern at that point. So I was like, no, I'm not doing surgery
Yeah.
with it.
So a tilted pelvis is
Mm-hmm.
different from a tilted uterus.
Mm-hmm.
Um, and I'm not 100%. I'm not an
Well,
OB-GYN, so I can't speak specifically to that, but I do know that it normally doesn't affect
and I
fertility.
think I'm using the word different. I think
Okay.
they were saying the tilted pelvis, but
Okay.
I said the use. But yeah,
Yeah.
and nothing was wrong. But to hear you say that you just noticed that their pelvics were tilted different,
Hmm.
that's very enlightening and empowering, you know?
Hmm.
Yeah, yeah. I just kind of wanted to touch on that
Yeah.
because Wow. Because so many people here are saying, me too. I had a tilted pelvis. Me too. Me too. I was told that too. Me too. Me too. So,
Yeah.
yeah, a lot of credence there. So, whew, let's talk about, well, I think you did talk about this, some of your own, what did you experience with your pelvic health? Were there anything there that you experienced that sort of kind of brought you deeper into this work?
So I touched on that I had my first son at 29 weeks.
Yeah.
I was not in labor. There were no
Mm,
signs of labor whatsoever. So they had to do a cesarean for him.
mm, mm,
Um, well, they could have induced labor, but at the point that I was at with such a high blood pressure, they didn't want to increase my blood pressure. So
mhm,
had a cesarean.
mhm.
Um, I did not find out until I went back to school to do continuing ed specifically for pelvic floor, um, that cesarean scars, if not addressed, can lead to pelvic floor dysfunction.
Wow.
So I definitely started noting an increase in um, pain during sex.
Mhm.
Um, I had that during after the first child.
Right.
After the second one, I started experiencing personally a slight prolapse, not one that's like super concerning or
Right.
noting, but just like, oh, that's different.
Yeah.
And then also just a little bit of leaking, which I didn't have after the first one. I
After the first
developed after
child.
the second one.
Wow.
Um, but by the time I was pregnant and postpartum with the second one, I was already head deep in transitioning into women's health. I was
Oh,
already sold at that point. So,
wow.
yeah.
Wow. Yeah. So there are those personal experience. I want to talk about this, Dr. Kris. I want to talk a little bit about your background, your studies, your path,
Hmm.
and how you became who you are today and doing the work there. So take us a little bit about your childhood journey and just kind of bring us, on that journey of your life of becoming Dr. Kris, the doula, working in this area of expertise that you do, advocating for women, women's health, pelvic expert. I'm going to call you that because you are, and advocator for women's health and pelvic health in particular. Yeah.
So when people ask me this question, my answer is the universe told me to do it.
I love it. I love it. I love.
As a kid, I think once or twice I said I wanted to be a doctor. Like if they asked you, what do you want to be when you grow up? And I was like, oh, I want to be a doctor. And I never really like
Mm-hmm.
thought much of it. That was just the generic answer.
Yes.
And what I really wanted to do was be a sidewalk painter in Paris. And my dad told me that I didn't want to do that. So
You wanted to be a sidewalk painter in Paris.
that was my dream. um, I when I started school, when I got into college, I think I wanted to be a lawyer, and my dad also told me that I shouldn't be a lawyer. Um, he was very blunt. He told me that I was a terrible liar. So he said I couldn't be a lawyer. No shade to all of the lawyers out there, but
There-
that's what he told me. And so eventually I got into athletic training, which got me into wanting to do physical therapy. So I'm in physical
Mm,
therapy school, and the program that I was in was very big on you have to explore all of the different avenues that physical therapy
Mhm.
has to offer. So you have to do a little bit of this and a little bit of that and a little bit of that. Put your toe in everything.
Mhm.
And so I was introduced to women's health. That's what they called it at the time that I was in school. Now they call it pelvic floor. Do they
Mhm.
call it pelvic health or pelvic floor for the certification? But
Yeah.
at the time, it was women's health. So
Yes.
I was introduced to women's health during my ortho rotation, and the clinical instructor that I had, she also would go and give talks to the local hospital.
Mhm.
And I went and sat in on one of her talks, and at the end of it, she had a slideshow presentation, and there was a photo of a tombstone.
Oh,
And
wow.
on the tombstone, it read, "No woman should leak her pants when she laughs," or something like that. And it made an impression on everyone in the room.
Yeah.
um, um, moving forward, I had to do a an elective course. I decided to do my elective course, diving deeper into pelvic floor therapy,
Mhm.
because that's what worked out with my schedule.
Yeah.
And then when I graduated, I never thought about it again. I was like, I'm doing acute care, I'm doing neuro, I'm doing
Mm.
everything but that.
Yes.
And every time I interacted with a new colleague or something like that, they were like, "Have you ever thought about doing pelvic health? You would be really good at it." And I was like, "No." Why do you say that?
Mhm.
And literally it just kept happening.
Wow.
And I would shut it down every time, like, this isn't something that I'm interested in. No, 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 no,
Mhm.
no.
Yes.
And then when I had my first son, and just all of the things that they don't tell you
Mhm.
um, about birth and hormones and the changes in your body.
Mhm.
That's when I had the aha moment. Like, this is why this
Ah.
is good.
Mhm.
And that's why I choose to specifically treat this population of patients, because there wasn't that available for me when I
For
was going
you.
through it. Yeah.
Wow. Powerful, a very powerful journey. So, my podcast, we kind of talked a little bit about it, and it's before the proof. And so, when the universe was whispering to you that this is the direction you were going in, you went in that direction before you had the proof. And so, you ended up there. That is an incredible story. And so, for those who want to know, talk a little bit about your degree and where you have your PhD studies at, and to quantify that. I know you do I don't even think I covered half the work that you specialize in, and really at the top of your class in this specialty, and you have a personal connection and a passion for all of these areas, just so people can know a little bit more about where you have focused your energy and your attention and your passion and love as well. Yeah.
hmm so I did my undergrad at Cal State Long Beach
Mhm.
in kinesiology. And then I went
Ooh.
to Emory University to do my doctorate of physical therapy. And then from there, I did all of my pelvic floor continuing education through the Herman and Wallace Institute. No, we
Mhm.
just call it Herman and Wallace. Everyone knows what we're talking about in the
Yeah.
PT field.
Yeah.
um, and then after working specifically with just pelvic floor in the clinic setting, Um, the clinic that I worked in, I'd say 95% of all of the patients were pregnant or postpartum. And
Mm-hmm.
so I had women who were asking me during their pregnancy, like, hey, can you be present for my birth? Like, can you be in the delivery room with me? And I had women who were postpartum who I was meeting for the first time who were saying, man, it really would have been great to have someone like you present with me during my birth. And my response to that was like, well, I don't do that. That's a whole nother
Yeah.
profession. um and so that's what got me into becoming a birth doula or birth worker.
Yeah.
um so I started doing birth doula work. We're in
Mm-hmm.
26 now, so about almost 3 years ago. um and that um led me into doing placenta processing and um, lactation support,
Mm-hmm.
and I do a little bit of childbirth education. So,
Wow. Wow. That's
oh,
powerful.
and I'm an advocate for Black women in particular because we
Yes.
have a 60%
Yes.
60% higher incidence of preeclampsia in this country. So I am
Wow.
a strong advocate for us, and I work with
Ye-
the Preeclampsia Foundation
mm,
with that.
Okay. Powerful. Powerful. Listen, we're gonna get into this. We got so much. I know Dr. Kris definitely has to come back. I want to keep you for as long as we can, but we're gonna get into some more stuff. You guys, we have not even touched the surface, but thank you so much for talking about that. But now I do want to move to the category before we leave everything about the pelvic, because this is so, I think this is a discussion that most women need to hear. That what often ends up taking women, I remember hearing this from Dr. Christian Northrum back in the day. And she had a guest on her show, and she said the number one reason women end up in care facilities is due to the pelvic floor. I was like, wait, what? So I want you to know that pelvic health is really your health. Like, this is something for all of us, but women in particular, to pay very, very close attention to. And at that particular time, Dr. Kris, that's when I started really getting into the Kegel exercises. I want to talk about that because what do most women often misunderstand about these Kegel exercises, things to strengthen the pelvic floor? Yeah.
Not everybody needs them.
Whoa.
Kegels aren't for everybody. Um,
Whoa. Wait a minute. Wait a minute. Wasn't expecting that. They're not.
they're not for everybody. If you
Mm,
already have tension in your pelvic floor, all a Kegel is going to do is increase that tension.
wow.
It's
And
not going to help you.
it's not.
Um,
And will that weaken it even more?
it will weaken it even more.
Wow.
So it's really important to know where your muscles are. Are they tight? Are they tense?
Mm-hmm.
If so, then you need to work on what we call down training or
Mm-hmm.
lengthening them,
Mm-hmm.
to get them to a point where you can have a good strength length curve.
Mm-hmm.
So if you think about if you're holding a gallon of milk
Mm-hmm.
and you got your bicep and you're holding your
Yeah.
gallon of milk, and we start off at the beginning of the day, you're holding your gallon of milk, and then you're still holding on to it, but over time that gallon of milk is going to feel heavier and it's going to start to drip down, right?
Mm-hmm.
Your arm is going to drop down. And if I do a Kegel at this point, my arm is weak and
Mm-hmm.
I cannot fully come here, right?
Mm-hmm.
Um, and so it's just trying to add more stress onto that area. But if I allow it to come all the way down and I relax that bicep,
Mm-hmm.
and then I come back and try and lift the gallon of milk, then I'm going to get a stronger contraction and I'm going to
Got
be able
it.
to actually work the strength versus just holding it there.
Wow.
So Kegels aren't for everybody.
Mm-hmm.
It's really important to know, do you have tension? If so, you need to work on down training first. And sometimes that can be concerning for people because they've been holding and there's just tension for so long and there is that weakness. So when you do start the down training journey, they might experience leaking because there is that underlying
Ah,
weakness that you were holding on for dear life to cover
right.
up. And then when you finally release it, then you get that little flow of things that you don't want to happen.
Right.
But then you can start your strengthening journey and
Afterwards.
incorporating, yeah. Um,
Mm.
and it might not be Kegels. It might be more beneficial for you to work those
Mm-hmm.
larger muscle groups, your adductors, your inner thigh muscles, your glute muscles, your abductors, your outer thigh muscles, to help give more of a well-rounded strengthening instead of relying on these very small, tiny muscles to do the work.
Yeah. Yeah. That's powerful. That's powerful. At what stage of life should women consider seeing a pelvic health physical therapist? Or is this sort of an open window for depending on what's going on?
I'd say it's an open window. I'd say it's never too late.
Mm-hmm.
If you are coming in for like prehab,
Mm-hmm.
is what they call it. Like if
Mm-hmm.
you're going to have a total hip replacement or a total knee replacement, they send you to the PT to get stronger before you have the surgery.
Right.
It's the same thing for the pelvic floor. You have that, you develop that muscle memory,
Mm-hmm.
so that you can recover better postpartum, or so that you can have better recruitment of the muscles during pregnancy, postpartum, etc.
Mm.
Um, Same thing for like like people who have endometriosis,
Yes.
the excision surgeries. Um, they should definitely do prehab as well.
Wow.
It's just, the list goes on and on. But I also think it's a good thing for people to just have a baseline. What is my pelvic floor doing? What is my normal? So then if you know you're normal, you know your body's normal, then
Mm.
when there's a change,
You'll know.
you'll know.
Yeah, yeah. And what could someone expect when they're going through pelvic health physical therapy? What does that look like? What does a day in your life working with a client for pelvic health? What does that look like? Like, are we on all fours? We kicking our legs up? Do we
Maybe.
feel like we doing Pilates or
Maybe.
yoga?
Maybe. Very, very possible. It can literally be a gamut of things. If I'm
Mhm,
doing an evaluation, I'm looking at how your body moves in
mm,
totality.
mm.
Because, like we mentioned before, everything is connected. How's your jaw function? How is your feet function? What's the squat look like? What is
Wow.
your breathing look like? Breathing is so important. A lot of people
Mm.
don't breathe correctly. We just
Yeah.
walk around thinking that we breathe in normally, and we're using our a lot of accessory muscles, so they're very short and shallow, and we're
Mm-hmm.
not getting that full expansion through the body that we're supposed to get. um, if I'm doing an internal exam, I mean, I can do external exams, but
Yeah.
if I'm doing an internal exam, obviously I'm gloved. Obviously, I have
Right.
consent. It
Yes.
is a very sensitive area. If you need a
Mm-hmm.
chaperone, there's chaperones available.
Mm-hmm.
If you don't feel comfortable being touched, I will guide you through assessing yourself.
Oh, wow.
Um, So there's a whole gamut. But as far as internal, um, I'm never inserting just random stuff.
Stuff.
It's,
Instruments. It's not a
yeah,
pap smear. It's not a
right.
pap
It's
smear.
not a pap smear. Um, one finger is how I use my is how I do an assessment,
Mm-hmm.
gloved, lubed.
Mm-hmm.
Um, and I don't know if you can tell, I have very small hands. So for
Yeah.
me, it's, it's not that dramatic, but it can be dramatic, especially if you're not used to it.
Yeah.
So I'm always verbalizing what it is that I want to do, and I'm giving you a chance to respond and give me consent and let me know if you're comfortable with that, if you want me to stop, if you want me to avoid certain things,
Mm-hmm.
because I need you to be comfortable with the examination.
Yeah.
And sometimes I never do internal exams on people.
Right.
Sometimes it's just a visual observation.
You can tell by just by
Mhm,
how the body is functioning that
yeah,
where the work needs to begin to start to develop
right,
the physical
right,
therapy. Yeah.
right. And I said
Yeah.
I'm not inserting tools and stuff, but there are lots of tools that we can use in pelvic floor therapy,
Yeah.
just depending on what the goals are.
Yeah. That's powerful. That's powerful. Wow. Wow. And I love that you said, this is something we all should be thinking about, even women prior to giving birth or becoming pregnant is a great time to start working on your pelvic health before. We think about so many things after, after we have the baby. What's the recovery process? But
Mhm.
even to begin to start thinking before conception even starts, to start working on the pelvic floor. I think
Right.
that is so
Especially if there
transformative.
are
Hmm.
infertility issues,
Mm.
um, especially if there's a history of endometriosis, PMOS,
Hmm.
um, and then you combine that with infertility treatments, so IVF. Um,
Mm.
you really want to have a handle on any issues before you start the IVF process and
Hmm.
during the IVF process, because it can exacerbate pain,
Yes.
and you want to be fully supported throughout that.
That's powerful. Thank you for that, Dr. Kris. So, I want to ask all of our listeners, everyone here, how many of you were ever taught about pelvic floor before your pregnancy, before childbirth, or even before you experience any kind of problem? If you have, type yes, but if you haven't, I want you to type no, just so we can get just sort of I'm looking at all of the questions. You guys are really, really enjoying this conversation and how informative it is. But I'm just curious if any of you were taught about the pelvic floor at this time. Ooh, interesting answers. I hear yes, but it was negative. Wow. Okay. Lots of no's going on. Lots of no's going on. Was not taught about pelvic health. Yeah, because I certainly was not, taught about it. But there were some things that came up afterwards. But, some of these things could have been avoided or even prevented. So this is definitely a share you guys want to pass on. You want to definitely keep it for yourself as well. Because I don't know about you all, but I am learning a lot, and I have some more mind blowing stuff we're about to get into right now. So now I want to talk about and by the way, you guys, Dr. Kris's information is all available in the show notes. And you do remote
Yes.
consultations and things.
Mhm.
She does that. Y'all ain't even gonna believe. We gonna get to it. We gonna get to it. We gonna get ready to get into it. But I want to talk about the power of a birth doula, because this is something that's coming back on the radar. We know doulas are certainly not something new. But first, I want you to give us a little bit of story. You told us about how all your clients was kind of like, hey, can you come with me when I have my baby? I wish I had you there, during this particular process. And that kind of opened up the window for you to go in and I'm sure your own personal story, to become certified to become a birth doula, to be
Yeah.
a doula. And so I want us to talk about that because I have some questions here. Um, you didn't just stop at the physical therapy, you kind of stepped into this space of a very sacred space, you know? So, ah, let's go into this. What exactly, and I know you're going to be able to answer this, what exactly does a birth doula do? Because there's all kinds of, stories out there about what a birth doula does. And so I want to hear it from you. What does a birth doula do?
I want to start with, we do not deliver your baby for you.
Wait a minute. Wait a minute. We need sparkles. Ah, because
I want to start with that because I have been asked multiple times, and I'm like, nah, that's
not what
that's
I do.
that's outside of my scope. I don't want to be sued. Mm-mm, no, I'm not a midwife. I'm not an OB-GYN. I'm a doula.
I'm a
Very
doula.
different.
Okay, now that we got that out the way, because that was my next question, like the difference between a doula and a midwife and a nurse and an obstetrician. What is the difference? But yes, you cleared, I think you made that very clear for all of us here. We got it.
As a birth doula, I am there to support you during pregnancy, during your labor, and I give support up through the first 6 weeks postpartum. Um,
Mm,
but I'm not technically a postpartum doula. I just make myself available if to keep an eye on things,
yeah,
going
with the
back to that
client.
whole preeclampsia thing. So I
Yes.
I want to make sure you're okay.
Yeah.
um, but we're providing support. If you need someone to go to your doctor's appointments with you,
Hmm.
I will come to a doctor's appointment or two with you, depending on how close or far you are from me.
Yeah.
I will go through birth prep work with you. So how are we breathing? How are we moving? How are we looking at our pelvic floor? We're going over some childbirth education. What are the different phases of labor, and what can be expected? And then when we're looking at the actual labor process, I'm there in the room with you. I am providing physical support, I'm providing emotional support.
Hmm.
Um, if you feel like you cannot speak up, if you need someone to speak up for you, and I know this may be a little controversial for some people,
Hmm.
but I'm going to speak up for you. If you have made that clear to me that you feel nervous about doing it, I'm going, because I'm that safe space for you in that room.
Yeah.
Um, I am um, basically making sure that whatever um, your plan, your birth plan, what you want to happen, I'm trying to get as close to that as possible.
Okay.
Yeah.
Okay. So here's a question. We're in the room.
Mhm.
I'm about to give birth.
Mhm.
Who needs to be in the room with me? I've requested you as my doula.
Mhm.
Who else needs to be in that room with me?
If we're in a hospital setting, it's going to
Hmm.
be the labor and delivery nurses. There's going to be multiple of them.
Hmm.
Um, there's going to be the midwife or the OB-GYN.
Hmm.
Um, if we're in a teaching hospital, there's going to be some additional doctors,
People there.
people looking as well.
Hmm.
Um, if you have a support partner, whether that be your husband, your spouse, your mother, your sister, your brother, whoever that those
Person is.
people
Yeah.
are,
Hmm.
they can be there too. I've had clients who have people on FaceTime who are like, I can't be there physically, but I'm my energy's here and I'm
I'm here
present.
with you in spirit. Yeah.
I'm holding the camera and angling
Wow.
stuff. So whoever you want to be present in the room can be present in the
In the
room.
room. Now,
Sometimes it can get a little crowded and we do need to remove some people.
mhm.
But whoever you want to be there can be there, unless then we go into the cesarean,
Okay. Something
which
else. Yeah.
you're in the OR. You can only have one support person. So whether that be your spouse, your mama,
Your doula.
or your doula. But they
Mm.
normally don't let both the doula and the support person in the OR.
Okay. Okay. And if I choose to have a home birth,
Mhm.
who needs to be there?
So it could be just you and your significant other.
Mhm.
It can be a midwife
Mhm.
and their support person.
Mhm.
Um, and it can be as intimate as that.
Mhm. So, does a doula need to be present?
It would be very helpful.
Okay.
um, I feel like the home birth setting um, allows for more personalization
Mhm.
of what you want to occur during your birth.
Mhm.
And so doulas aren't always necessary to achieve that.
Mm.
Um, it's nice to have someone who's designated for that purpose,
Mhm.
but you can designate anybody to,
For that. For
for
that.
that. Yeah.
So, I want to ask you, Dr. Kris, because often I hear people say, I want to have a home birth and I want to have my doula with me.
Mhm.
So you said it could be the person, it could be their partner, and that's it.
Mhm. Some people do that. They're
So
they
is
Mhm.
there any kind of legal thing that says you must have a baby in the hospital?
No.
So you can give birth wherever you want.
Yeah.
So, that being said, there doesn't need to be a nurse there. There doesn't need to be a midwife there or anyone.
Nope. If you are most people who have home births without it's basically like an unassisted birth. So they have done the research themselves. They feel very confident that they are going to be able to guide the labor process and the delivery process. They've done their homework when they're choosing to do that.
Mhm.
Um, so it's not a requirement.
Mhm.
Um, and I feel that the people who do choose to do that definitely view birth as a more spiritual experience
Mhm.
than just the regular, like, oh, I'm having a baby.
Okay. Okay. Now I'm gonna take you out there a little bit because I want to ask this question. Then I'm gonna bring it back because someone in the audience brought it up. So I was doing some research once, and I can't remember where it is. Often I go on these spiritual excursions in the Akashic records, and I'm swimming with the dolphins. And I found this place in Hawaii. I don't know if you've ever come across their work, but it's a whole place in Hawaii that's dedicated to the research, um, development of dolphins, the connection between dolphins and the connections between humans giving birth and dolphins giving birth. Even though on their website, and even the person I spoke to back in the day said they have not actually had this take place as of yet, like really a space where there's dolphins and put a human there and let them give birth in the ocean. However, based on their research and the dolphin in the water, this is a more healthier, more natural, they feel, experience that women can have when giving birth. And so, that being said, someone could actually go in the ocean and give birth. Not saying we recommend it, but could they do that?
Yes. um and I hesitate because I'm like, technically yes, people give birth in water, like in pools and bathtubs.
Yes, because we know the bath water. They have the bathing, what do you call it? Birthing tubs.
Birthing tubs, yeah.
Mhm.
So you can give birth in water. I don't know about if seawater has any effect on that. I don't
Mhm.
know like how deep in the ocean do you like you'd have to tread water. I'm not exactly sure about all of the
Right. I,
logistics with that.
yeah, yeah, but someone could do that. And I asked this for my daughter. When my daughter was born, I actually had a birthing room in the hospital. And I had the support, I had the birthing room, and there was a water tub, although I opted not to get in it because at the time I was in Colorado and they, I don't know if the law is still there, but they only do natural births. And so if you're in any kind of distress, there's like a special hospital you send to, but everyone gives birth naturally, meaning no medication, no whatever. But they have more of a holistic approach. At least the hospital where I gave birth at, they did. And but there were some of the women I remember just going to some of the the classes and things that were excited about being in the birthing tubs,
Mhm.
to give birth.
Mhm.
And so I was just curious about that thought. However, if we talk about this, we have to also talk about the more shadow side of this. And there are some circumstances that is not recommended, um, that you should not do this. Like you said, people who opt to do this should be very well studied and researched because, in essence, what you're saying is you're taking full responsibility not only for the mother's life, right, but the
Mhm.
baby's life and
Exactly.
everything that transpires that is happening that's going on at that moment. So by no means are we here to advocate to just be at home and say, "Hey honey, it's time we going to do this and we going to pull up
Mhm.
a YouTube video." That's not
Exactly.
what we're telling y'all. But we are also telling you that this is how much power you have. And even when you go to the doctors, and you choose more of a traditional route to give birth, that this really is your experience. And these are people here to assist you, help you, and to facilitate to make sure the health of yourself and your baby is in the best care.
Mhm.
And to me, that just seems more empowering because I think that there may have been a misconception that something has to be done a certain kind of way. And you're saying, no, you get to do this the way that you want. I love what you said earlier, and so many of the viewers kind of echoed it when you said, I fired that doctor
Mhm.
because I realized, no, 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 I don't feel like this is not the best care for me. And so we have the ability to do that. Yeah.
So I do want to mention that that's in essence what we're supposed to have,
Mm-hmm.
but we do have to recognize that there are many places, many hospital systems that have their own protocols in place.
Mm-hmm.
Um, and once you enter through their doors,
Oh, you
um,
got to go by
there
their rules.
there are instances of medical, I call it medical violence, where they
Mm-hmm.
force you to do things based on what they want, based on their protocol, which
Mm.
is why I feel like having a doula in the hospital setting is more important than having a doula in the home setting or
Wow.
in the birth setting, because
Wow.
you really need someone there who can advocate for you. But I've seen instances of
Mm.
videos of where the doula is being kicked out of the birth room, because the hospital staff doesn't want the birthing person to have that advocate, to have
Wow.
someone to go
Mm.
against what it is that they're recommending. And, you know, obviously, it should be everyone's goal that we're keeping the mom and the baby safe.
Yes.
Um, whether that means a certain intervention needs to take place, or whether that means just waiting and
Yeah.
seeing
How
if
the
there's a
body,
change in how the
yeah.
body responds to things. And so many times
Mm.
um, there's a rush to give a certain intervention, and then that intervention causes the need for another intervention, which causes the need for
Mm.
another intervention. And now you have this person who was otherwise healthy when they came in,
Right.
um, that now, who could have had a vaginal delivery, now they are having a
Yes.
emergency cesarean
Yeah.
because of the cascade of interventions.
Wow. Yeah. Yeah. That's powerful and great information to know. Thank you so much for that, Dr. Chris. That yeah, that says a lot. Huh. So, um, why might a woman need a doula when she has maybe a loving partner and even a supportive family? Why would a woman might still need a doula?
There are a few reasons.
Mm-hmm.
When I am your birth doula, I'm not just the person who's giving birth doula. I'm the spouse's doula, the family's doula.
Ah,
I'm
oh,
supporting
okay.
the entire team,
Mm-hmm.
um, to make sure that everyone feels supported in that space.
Mm.
Um, there may be instance where the birthing family, we'll call it, um,
Mm-hmm.
doesn't isn't um, well medically versed, and
Mm-hmm.
so they don't understand what's going on. What does this monitor mean? What's that beeping sound? What's this? And so it's someone there who's dedicated to you
Mm-hmm.
to explain some of those things,
Mm-hmm.
um, to again be an advocate,
Mm-hmm.
to make sure that you feel heard and supported.
Mm-hmm.
But also on the flip side, um, when you're in the labor and delivery scene, unit, a nurse may have two or three moms in labor at the same time.
Mm.
I hear often from labor and delivery nurses that they like it
When
when the
the
doula
doula
is
is there,
there,
yeah.
because then they don't have to focus so much on that particular patient. They can
Mm-hmm.
focus on another room that doesn't necessarily have that support.
Mm-hmm.
And
Mm-hmm.
so it takes stress off of the system.
Yeah, yeah. And, you know, I love this from one of the viewers. She says, my husband is loving and supportive and also clueless. Would love a doula if I ever had a birth in a hospital, especially because that could be true. They could be very loving and very
Mhm,
supporting, but they can't tell when maybe you're not breathing right or when you're in excruciating pain and, you know, things that your doula would have been able to ask the right questions to say, are you comfortable? You know,
right.
what are you feeling right now? So there's a big educational piece and a support emotionally. But you said something key that I don't think I really thought about. You're not just a person, the woman who's giving birth doula, you're doula to support everyone who's there.
Right.
And that is so needed. Mm,
And I
mm,
mentioned how I do like childbirth education during the prenatal appointment, not the MD prenatal appointments, but the like my own appointments
Okay.
with the client. And I want whoever is your support person to be present
During
during
those.
during those meetings, at least once, so
Mm-hmm.
we can go over different comfort techniques, so we can
Mm-hmm.
go over the education piece, so we can go over those things so that
Mm-hmm.
they're not so clueless, so that they
Mm-hmm.
know something going into the space.
Mm-hmm. Mm-hmm. I love that. Now, here's a question, and I want to go a little deeper in this, but what role does informed consent play during birth?
It should be everything. There's they should be getting giving receive a medical provider should be receiving informed consent for everything that they do to you. If they put an IV in you, if they are doing a cervical exam, if they are just going to look, and they need to be, is this okay before I do it?
Ah,
And the
gotcha.
patient, the birthing person should understand what they are consenting to,
Mm-hmm.
whether it's a medication, whether it's just anything. That is so important. And
Yeah.
um, I have seen
Mm-hmm.
that what um, I've particularly seen it in teaching hospitals.
Mm-hmm.
So the resident or OB-GYN comes in, and they say, I want to check your dilation. And the birthing person is like, okay, I'm okay with you doing this check.
Yeah,
They will put on gloves. Now, I don't know if you've been in the hospital, but gloves come in many different colors.
they sure do.
Um, but in general, the colors that we see, well, at least here in California, the colors that I see are like a blue color, a
Yeah.
purple
Yeah.
color, like a lavender color.
Mm-hmm.
Um, I have seen them pull out a like tannish white color one,
Mm-hmm. Yes.
and that one will have a little on the index finger,
It'll have a little what now?
like a ridge, like a rough
Edge on it.
edge to it. So
Mm-hmm.
when they go in to do that cervical exam, they can intentionally break the waters if your water hasn't broken yet.
What?
So they're not telling you that they're going to break the waters, but when they go in, because normally if they say they're going to break the waters, they'll do it with like a hook. It kind of looks like a
Yeah.
fishing hook.
Yeah.
But if you're someone who's like, yeah, I don't want my waters to be artificially broken, et cetera, um, mainly because it increases the risk of infection,
Right.
um, they, because it's in their mind, like, oh no, we want to move this
This along so we can get,
along, right?
yeah.
They will put on that white glove and go in so that they can kind of nick it a little bit themselves, and then now they've
Wow.
started that process.
They started that process.
Hmm.
Wow.
Oh, I just did a cervical check.
Yeah,
No,
no,
yeah,
no. Listen, this is so powerful and so informative. Now, that's an eye opener for me, because now that I think back, I think that's how I kind of went into labor with my daughter with them gloves with the little thing on there. Wow. Mm, okay. Well, I love that. Um, I want to kind of wrap that up to just really talk more about the doula, but I want to move this along because we're gonna get into the placenta here because we got some good information Dr. Kris has here. Some I haven't heard, kind of mind blowing a little bit. We're going to talk about, but I want to talk about just kind of wrap this up with the doula, and so that everyone understand that the doula doesn't take power away from the mother and the partner. Because as many as beautiful stories I've heard about doulas, I've also heard those stories where the person felt like the doula was sort of kind of overstepping their boundaries there. And that's not the role of a doula. To do that. A skilled doula really helps to create the conditions in which the mother and her support system can really access more information, feel sort of that support, the confidence, and just the steadiness of going through the process of giving birth and bringing a new life into the world. And so that's important to understand if you're thinking about hiring a doula. By the way, I know we have some doulas in the building. Let us know if you guys are a doula as well, who are tuning in. And so now this is going to bring us to the placenta. And I want us to talk about this. And so, something Dr. Kris told me, and I don't know about y'all, maybe I'm on the slow bus here, but this kind of blew me away. And we were just casually talking, and she said, I was talking about the placenta. I said, what exactly is the placenta? And she said, Ms.Blue, the placenta is an organ. So, yeah, we're going to get into the placenta. And I want you to talk about what the placenta is and what does it perform during pregnancy.
So the placenta is an organ that is grown specifically during your pregnancy to help support the development of the baby in utero. And then once you deliver the baby, then the placenta is delivered then afterwards. So it's literally, its only function is to support the growth, development of the baby, and then it is discarded from the body.
So that just blew me away to know that the body, I don't know what I thought the placenta was, but I just didn't equate it to a whole organ. When you think about the organs in your body, and during this time, the placenta is built, formed, alive, and functioning within a 9-month window. Probably, how soon does the placenta start to form within utero of the baby?
I'm trying to think of the exact week that it's the gestational week. I know I'm going to give a wrong number, but it's around 7 to 10 weeks, 6 to 10 weeks, somewhere around there,
So
where
within
it's
it's functioning.
mhm.
It's literally so 6 to 10 weeks. We have a whole new organ in the body, and this is the placenta. And let's talk about what the placenta does and what work it performs during the pregnancy.
So it's essentially bringing or transferring oxygenated blood from the mother into the baby, and then taking that used blood out of the baby and back into the mother to be recycled and oxygenated. Any nutrition that the mother ingests, it's broken down, processed, not broken down, it's broken down in the mom's stomach, but the placenta helps take that broken down nutrition and then funnels that through to the baby. Um, so that's its main function in utero. But then what got me really interested in it is when I sat across from the perinatologist during my preeclampsia hospitalization, and I had so many questions like, what's going on? What can I do? What's happening? Etc. And when he came in the room and he kind of gave me like, here's what the plan is going to be. And I started asking questions. He said, okay, hold on. I'm going to do my rounds and then I'm going to come back to you. And he sat down in the chair, sat down in the stool, and we sat and had a very blunt and honest conversation about
Mm,
it. And one thing that he mentioned that stood out to me at that time was that um, with preeclampsia, they don't know how, they don't know why, which is why research is really important in this area.
mm-hmm.
But something in the placenta is malfunctioning. It's not doing what it's supposed to be doing, and that's what leads preeclampsia.
Wow. And that's what leads to the preeclampsia. It's
Mhm.
actually coming from the placenta.
Right.
Now, I want to go into a deeper conversation. What makes up the placenta? Is this just something the mother's body is producing? Like, what makes the placenta? What brings that to life?
So to get pregnant, you need both woman and man. You need
Mm,
egg and sperm.
mm.
The placenta is a majority of the male's DNA.
I want y'all to hear that because when Dr. Kris told me that, I said, say what? The placenta is made up of mostly the male's DNA. That's one to grow on. That's one to grow on. And it's something else to think about because often the father's role usually has been minimized to just being the sperm. And whereas the whole life and the whole nurturing of the mother and the baby is supported mainly by the father's sperm, the DNA, the particles. That's what is mainly, the placenta is mainly coming from the masculine energy. I don't know about y'all, but that I didn't know that. So when we saying my baby, my baby, my baby, and this is me growing my baby, but we're not growing it alone. And of course, we give the credence to the father for, you know, offering that part, but the placenta, which is without the placenta, we don't have a baby.
Right.
Yeah, I thought that was deep. That was deep and deep to know. And will bring us into some other things that we will talk about in a moment, getting with the placenta. So this is what the placenta is there. Now, I want to talk about some work that you're doing that when I first kind of seen you in action with it, when I seen you and I was like, what is she doing? I want to talk about your work with the placenta and how it can be first useful. We just talked about what it does during the birthing process, but I want
Mhm.
to talk about how it can be useful after the birthing process.
Yes. Um, so in the US, I can't speak on any other countries. In the US, you deliver that placenta and it is considered what they will tell you medical waste and they will dispose of it. Um, and it's like, really? A whole organ that was grown from scratch
Mm-hmm.
is medical waste. It still has a lot of nutrients, if it's a healthy placenta, inside of it that can be used for the health of the mother postpartum, or in other traditions, to just honor that and honor the role that it played. And it can be used as a fertilizer for plants and uh, growing a tree in honor of your child, etc. So I process placentas to help with um, mood disorders postpartum, energy levels postpartum, um, assisting with milk production postpartum. Um, those are the main things
Those
that,
are the main things.
yeah.
Well, that's a lot in itself, especially when we talk about postpartum that can be 2 years to life.
Hmm.
And, we often know how significant the mother's milk is to the baby in their health and longevity and just their stamina in life. And so, in a sense, in essence, now I've heard in a lot of cultures where they will take the placenta and they will actually bury the placenta in the ground and
Hmm.
do like a ritual ceremony.
Hmm.
There are also some cultures that will take the placenta and they will cover it with this fragrant water and dry it in the sun because they believe the placenta is actually connected to the child's soul. You understand? And there's even some cultures where they actually go in and do like an oracle reading and they can prophesize over that child's life and through the placenta. So there's many different cultures that use the placenta in so many different profound ways. And
Hmm.
so when you told me, and I seen you were all covered in your gear and you were in the kitchen, at first I thought, wait a minute, is she a chef too? She's a doctor and a chef? And I seen you had this stuff in the picture, and then I read, so you actually prepare placenta for mothers
Hmm.
who want to ingest the
Hmm.
placenta. So in essence, and I'm just going to keep it blunt,
Hmm.
we eating our own organs.
Hmm.
And you prepare this for mothers. So we got to talk about that.
Hmm.
We got to talk about what does placenta preparation and preparing it, what does that look like for you? What do you do? And how can you ingest this?
So there's two ways to process it. You can do a steaming method where you're essentially kind of low grade cooking it with infusing it with herbs
Mm-hmm.
um, prior to the next step, or you can do a raw method where you're just cutting it up raw and then taking it to the next step. And the next step would be dehydration. So you're dehydrating it to literally like beef jerky strips. Um, and then you're grinding that up into a powder, and then you're taking that powder and placing it into capsules.
Mm-hmm. And then you're taking the capsule once a day.
And then you're taking the capsule, you're starting off like once, twice a day, like you're building it up for your
Mm-hmm.
body, seeing how your body responds to it.
Mm-hmm.
It is very high in iron. Um, so you want to monitor how your body is accepting that.
Mm-hmm.
Um, and then you're getting up to about six capsules a day.
Mm-hmm.
And then that's normally I'm getting around 200 pills per placenta. So
Mm-hmm.
that's taking people into about their 6 weeks of postpartum.
Mm-hmm.
One thing that I like to do and that I encourage, I don't necessarily encourage it, but it's my favorite part of placenta processing is making a tincture out of it because um, if you're okay with it, it's preserved with alcohol.
Mm-hmm.
And so it's shelf stable.
Ah.
And you can use it throughout your postpartum journey
Mm-hmm.
for support. And then some women actually keep it and save it for when they enter perimenopause to help balance out their hormones during that time.
Wow. And so, Dr. Kris, how did you get into? Did you just wake up and say, you know what? I'm going to start cooking up some placenta around here. I'm going to deliver the babies.
I
I
don't
help.
deliver babies.
No, oh, wait, wait. Yeah, let me correct myself. I help you with your baby. Okay, I help you with your baby. I'm going to help you with your pelvic health. And
Mhm.
then I'm going to go ahead and I'm going to take that placenta and I'm going to mix up a nice concoction for you.
I think placentas are really cool. I think childbirth is really cool. I
Yeah,
watch
I love it.
videos of babies being born all the time. My friends are like, "What are you doing?" I'm like, "Look, either join in or leave me alone." um, I think they're cool. And like I said, when I found out the role that the placenta plays in the development of the child, um, that really piqued my interest there.
So hold on before you go there.
Mhm.
So, how did you go through special training for
Yes,
this? Yeah, yeah.
yes, yes.
So you became a doula.
And
Mm-hmm.
at the same time, I did my placenta processing training, which is a lot of food safety stuff. So
Mm-hmm.
making sure that it's being kept at the appropriate temperatures, uh, making sure that it's being cooked at the appropriate temperature, and then being prepared. That's why you saw me in all of my PPE, making
Yeah.
sure that I'm not transferring anything to it and it's not transferring anything to me. Um, and so just making sure that it's safe
Mm-hmm.
once
And how long
it's
was that
delivered.
training? How long was that training?
A few weeks.
Yeah, yeah. To go through the process. So it's kind
Mhm.
of like you're handling meat
Yeah.
because it's an organ.
Mhm.
And so, yeah, okay. I was just curious of how you got into it. So, what goes into it? I know you told me it's very bloody.
It's very
It's
bloody.
it's extremely y'all, we had a whole conversation and I caught all the visuals. She said it's bloody. Like if
Very
you
bloody.
kind of squeamish about being around blood, this ain't for you. But yes, so tell us about it.
Yeah, like I said, it's very bloody when I am starting the processing. The first thing that I need to do is go through and kind of rinse it and look through it, making sure there aren't any like impurities within it, any like nodules or anything that might.
No, I got a question.
Mhm.
So you have to go through almost like a coroner.
Yeah.
Do you report anything and let them know if you find anything to the mother?
No, the hospital will do their preliminary
Oh,
look
okay.
of
They
it as well. Yeah. So if they notice anything at the hospital, they're going to say it's not viable for ingestion and they will not release it for that purpose.
Ah,
Um,
so there are conditions that the placenta
mhm.
is not available for consumption. What are some of the top, maybe three or four reasons someone could not ingest their placenta?
Main thing is going to be an infection.
Hmm.
So um, if there's an infection, um, especially to the point where the mother is requiring
Hmm.
um, uh, an antibiotic course
Hmm.
systemically,
Hmm.
then we want to avoid ingesting that
That,
infection.
yeah, yeah.
Um, Same thing with preeclampsia. There's not necessarily an infection where you need an antibiotic course, but like we said, that's where it starts. So that's not
Hmm.
going to be viable for
Hmm.
ingestion. Um, GBS is not an infection, it's just bacteria that can be present. So even though you do receive antibiotics for it, it's not related to the placenta itself in the body. So um,
Hmm.
it's generally safe to still ingest placenta when there's GBS present.
Okay. This is a really good question. Someone asked, what if you have a home birth? Does the hospital still need to inspect the placenta?
If you have a home birth, they're not going to inspect it. So
Oh.
that's something that you would be um, taking
Taking
responsibility taking
For
responsibility for yourself. Yeah.
hmm And so let me ask you, when someone gives you the consent to do this to their placenta,
Hmm.
and let's say they had a home birth,
Hmm.
um, do you check it? Is that one of the reasons you're checking it? Or is that not in your scope to take a look at?
So I cannot tell if there's an infection.
Mm-hmm.
What I'm looking for are there calcifications in
Mm-hmm.
it,
Mm-hmm.
which I'm really just cutting those out.
Mm-hmm.
That's not going to be part of what's um, essentially ingested towards the end. I'm cutting those out and discarding them.
Yeah.
Um, but my consent paperwork is pretty much like I am taking responsibility for, letting me, the processor, know if there's any known infections, if there's anything that I need to be made aware of,
Mm-hmm.
that if they have a home birth and um, let's say they find me afterwards,
Right.
like some days later or whatnot. Oh, I kept it in my freezer. Okay, how long was it left out at room temperature before you put it in your freezer? At any point in time, did your freezer decide to stop working and it
Working.
wasn't kept, in that state? Did you take it out of the freezer at any point and then put it back in?
Wow. So
So,
that's how long does it have to go from point A to point B, meaning leave mother and put somewhere till you can work on it.
right. So, after delivery,
Mhm.
it needs to be in a refrigerated state within 4 hours.
That's a
Um,
short window.
it's a very short window. Um, so, um, if you're even thinking about wanting to process your placenta, then that's something that you need to have arrangements made for. Was
Ahead
it
of
at home?
time.
Was it in the hospital? And the
Yeah.
hospital, they're not going to put it in their refrigerator there. The
Mhm.
most they're going to give you is some ice to keep it chill on.
Mhm.
So, who's going to come and pick it up? Did they forget it in their car for 4 hours and then bring it back inside?
Yes.
Like what are all of the different conditions there? So
Mhm.
it's definitely something that you have to be intentional with if you want to move forward with that, just for safety reasons,
Yes.
because it is meat. It's an
Mhm.
organ. It's meat. Bacteria can grow on it, and then now you have a whole uh, other issue
Mhm.
because you've eaten something that's essentially started to spoil.
Right. And so here's the question, because I know the placenta itself is an organ. How long does it stop pulsating after birth? So in essence, how long does it take before it dies?
Yeah, that's a good question. And it's a little controversial
Mhm.
because there are some people who perform lotus births, who they
Mm.
believe that, you keep that placenta attached through the umbilical cord to the baby until it dries out completely and there's no longer any
Whoa.
exchange happening. And that's a whole uh, how to care for it
Mhm.
scenario as well. I saw it pop up. Would I process a lotus birth placenta for ingestion? No, because we've basically
Oh, yeah,
removed all of
remove
the
those.
nutrient. Yeah, it's
Yeah.
been at room temperature. It has not been
Yeah.
refrigerated at all. We're not processing that to ingest.
Mhm.
Um, Forgot what the original question
So
was.
how long does it take before the
Oh,
placenta
the
stop
the stop
pulsating?
pulsating.
Mhm.
Um, in the hospital, they'll say, "Oh, after a minute, it's done," or after
Mm.
2 minutes, like it
Mm.
really doesn't. Um, Nothing else is flowing from it. But like I said, placentas are very bloody. It's very vascular,
Yeah.
and so they'll say like, oh, when the cord, like I've heard some people say like, oh, you wait until the cord is white and then you know everything has gone through with it. Um, and the hospital will be like, oh no, that's not a thing. um, but I get a lot of these hospital placentas, and they're not doing delayed cord clamping longer than 2 to 3 minutes. The cord could still be pulsating at that time, and
Ah,
I'm getting them home. And like I said,
they're still, what you found in your actual practice is that they are still pulsating when you get them because of how the
well, not
disconnect,
still pulsating because it's
but
been
still not
cut, but
pulsating, but
yeah,
it's still technically alive,
yeah.
is what you're saying. Yeah. And so what do you have to do? You have to give it time then for it to stop? No. So it doesn't matter how soon or how after.
What do you mean?
Meaning, let's say you're the doula, you're on spot, the babe, they have the baby, you can literally take it home and start to work on it.
Correct.
Yeah. Yeah.
Yeah.
Mhm.
I can start right away.
Mhm.
Um, Depends on the time of the day that the
Oh
baby
yeah,
is
how
born.
long the birth was. Like you're not going to be with the mama for 14 hours and go home and process the placenta.
No, then it's going in the fridge
Yeah.
and, until I'm fresh.
Until you're fresh and ready. Yes, yes. Understandable, understandable. So once you get that and you get the placenta and you get ready to do your thing, like what is your own sort of sacred practice with this placenta? Like, is there anything that you do prior to getting into this work? And I say that, Dr. Kris, because it is kind of spiritual and it's sacred. Like someone handed over something so sacred and so powerful
Mhm.
to pass it on to you. It's almost like you become, you know, sort of that birth godmother, you know, in this full circle of life, you know?
Mhm. I'd say the only thing that I do, I call it a little woo woo, is I do say thank you.
Yeah.
Um,
Yeah.
I also talk to my plants and the trees, so
Yeah.
that,
Yeah. 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 I
that's
just
just
was
me.
curious if you had your, you know, your own sort of, because no one comes to this kind of work
Yeah,
without it being something sacred and spiritual, not not woo woo kind of, as we would
yeah,
say, spiritual, but real sacred work, you
yeah,
know? Yeah, so
yeah.
that's so do you get excited when you're
Very
doing
excited. Yeah, very
She said, I
excited.
get very excited. And so, what kind of things are you thinking when you're preparing it? Like, what makes you so excited for
I
it?
don't I just think they're so cool. I just
Yeah.
being able to work with it, feel it in my hands,
Hmm.
you know, seeing the vein outline. You think of that
Wow.
tree of life, like you can really see that on one side of it.
Wow.
When it comes, you still have the sack that the baby was enclosed in. So you can
Mm.
lift it up and you see, like, oh, wow, the baby lived in here. And this is
Yeah.
where they floated around and flipped and turned and everything. I get very excited. I think it's so
Wow.
cool.
Yeah. Yeah. Your
Yeah.
energy just kind of went, your auric field just lit up like, whoa. Did y'all see that? She just lit up when she talked about it. And I'm sure a big part of it is what it's going to be doing for the family, what it's going to be doing for the mother's health, and
Mhm.
ultimately the baby's health, right? So, how soon from start to finish does it actually take you? So, if you were
Um,
preparing it for
of
a
48
family,
hours.
and they can start, they will have a finished product in 48 hours.
48 to 72 hours is my
Yeah.
turnaround time. Yeah.
Wow. And you said your favorite is the tincture
Hmm.
that they can. Yeah.
Hmm. And the tincture, it's, you know, it takes time for the extraction process to happen. So
Hmm.
there's, you know, a solid piece of that jerky sitting in the jar. And so that's uh, extracting out.
Mm-hmm.
everything from it for 6 weeks. So,
Wow.
like I said, that the pills will normally last you about 6 weeks,
Mm-hmm.
depending on how large the placenta is.
Mm-hmm.
And the so if they're taking the pills and then they get to 6 weeks,
Mm-hmm.
and now they've run out of pills, well, now the tincture is ready and they can continue the course if they need to.
If they need to, because
Mhm.
the tincture will last a lot longer. I know when I do my flower essence and when the alcohol is in there, like it's almost an endless kind of shelf life
Mhm.
that's there, that you can still have that, not have to worry about putting it in the refrigerator and doing all of this, and
Right.
keeps all the little nasty little things out there.
Mhm.
Wow, wow, wow. Mm. And so, what benefits do mothers commonly sort of give you feedback on after you have given them, whether they're taking the capsules or, well, I guess, do you still prepare it even if they're going to do it raw and just kind of like throw it in a smoothie and do that? Do you still
I
prepare it?
don't I don't do raw preparation, and
Mm-hmm.
as far as like the smoothies, etc.
Mm-hmm.
Just personally, I just don't want to take on that liability.
Yeah.
Um, but
Mm-hmm.
I do know that some people do consume it in that manner. Um, I'd say the biggest report that I get from women um,
Mm-hmm.
is their mood.
Mm.
So a lot of times, um, I'll get a client who this is their second, their third, their fourth child, and they've never had it done before, but they're reporting, oh, after my last baby, my postpartum depression was really bad. Like I was on anti depressants and
Mm-hmm.
all of this in therapy, etc. Um, I want to give this a try.
Yeah.
And then I'm getting messages a few weeks after they're taking it, months after they're taking it,
Mm-hmm.
and they're like, no, I felt really good.
Yeah.
Like I didn't
Beautiful.
experience that this time
Yeah.
around. And
That's
so
beautiful.
is it placebo? Is it
Mm-hmm.
something where it's like, oh, because they're actively taking something that
Mm-hmm.
magically their mind, I think it's deeper than that.
Yeah.
So that's why I continue
To do
to
it.
do that. Yeah,
Yeah, yeah. So there is no what am I trying to say? There is no research about this yet, as of yet, is there?
correct.
Yeah.
Yeah.
But you're making research, and we'll have that. That's going to go into the pot because soon this is going to be a known. I think this is going to be a major thing because one of the things I think I was reading some article and they were saying the rise of postpartum has gone up. Like most women who are giving birth, more women are experiencing these symptoms. And if there is something that can support, that can help to do this, it's definitely worth a try. Yeah.
I'm curious about that. Is the rise increasing or are they just now acknowledging it when it was
Mm,
already there?
yeah, and it was already there. Good point, Dr. Chris. Good point. Mm-hmm. Mm-hmm. Wow. Wow. Well, listen. I know we didn't cover a lot, y'all, and it's so much more that we can cover. I don't want to keep Dr. Chris. We're going on over 2 hours, and I know you all have enjoyed her questions, but I want to talk about some of the things that you have coming up at this time. And then we're going to also talk about where people can reach out to you, where they can connect with you, and where they can even work with you and also support some of the work that you're supporting out in the world as well.
Yeah. So for this year, I'm pretty much done for things coming up.
Yeah.
In May, we did our second annual Promise Walk for preeclampsia in the West Los Angeles area
Mhm.
with the Preeclampsia Foundation. So that's an annual event. Um, we're still accepting donations through October. That's when they close it out.
Mhm.
But the event has already passed. But
Okay.
if you are in another area, there are upcoming walks in different areas. So you can go to the Preeclampsia Foundation's website to see where those walks are happening. But the next one in West Los Angeles will be next May during Preeclampsia Awareness Month, May 8th of 2027. So that would be the only thing that I have brewing right now.
Mhm. Mhm. And for people to reach out to you, what is the best way you would love for them to reach out to you and to talk about the services that you currently offer within your practice?
So the best way to reach out to me is via email. I
Hmm.
know people like to DM on Instagram, and
Yeah.
I don't always see them right away. And I feel bad when it's been like 2 weeks, and I'm
Yeah.
like, oh man, I missed this message. Or sometimes it goes to like the spam hidden messages because it's not someone who I'm following, and I just don't see it right away. So the best way is email, which would be Dr.Kris at sacralpt.com. Or if you send there's like a contact me box on the website at
Hmm.
www.sacralpt.com. And that contact me or contact us, whatever it's labeled, will
Hmm.
go directly to my email as well, and I can see it there. Um, for services, I do in person, in home pelvic floor physical therapy in the West Los Angeles area.
Hmm.
I can do virtual physical therapy if you are physically in California,
Hmm.
um, just because I'm not licensed in other states.
Hmm.
But then if we're doing pelvic floor consultation and we're taking the physical therapy aspect out of it, then there can be consultations, coaching is what it's called,
Call. Yeah.
um, if you're located elsewhere, and that can all be done virtual as well.
Hmm.
Birth doula support in the West Los Angeles area, placenta encapsulation in the West Los Angeles area. Um, yeah.
Hmm. Hmm. And so I want to answer a question because someone put in the comment that I need a menopause doula so I don't end up in a home. Do you do that? And we kind of talked about that earlier because it's still pelvic health. And this is what you do as well for the pelvic health therapy.
Yes.
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 Mm-hmm.
So at that point, it's not a doula
No.
service. It's although you can have doula services for anything. They have deaf doulas and
Yes.
fertility doulas and the gamut. It's basically coined as a support person.
Mm-hmm.
Um, but um, pelvic uh, pelvic health
Yes.
um, is
Therapy.
where I like to
Mm-hmm.
navigate that area, is definitely something um, to help prevent pelvic floor dysfunction as we age, as we go through perimenopause, as we go through menopause,
Yes.
but also something that I am a big um, advocate of is seeing your OB-GYN to get, and this gets out of my scope, which is why I say go see your OB-GYN.
Yes.
But it's in ACOG's, the Gynecological Association, it's in their recommendations now for vaginal estrogen, topical
Yes.
estrogen, estradiol. that works locally on the tissues to help prevent UTIs,
Mm-hmm.
which is the main uh, cause of, uh, well, the incontinence is the pelvic floor dysfunction, but that pelvic floor dysfunction can also lead to the UTIs. So if we're having the estradiol, that estrogen working on the tissues,
Mm-hmm.
that can help mitigate a lot of that, and it's
Mm-hmm.
preventative care, and it's
Yeah.
$25 a tube, which is a lot cheaper than the 4.8 billion with a B
Wow.
dollars that it leads to in the healthcare system and costs because of nursing
Mm.
homes, hospitalizations,
Yes.
antibiotic courses, and all of the cascade that occurs after that antibiotic cascade has begun.
Yeah, yeah, that's powerful. That's powerful. This is such great information, Dr.
Mhm.
Kris. And I want to say thank you for bringing your wisdom, your training. I
Thank
feel like we got a
you.
whole little mini masterclass here today in education, your experience, even as a mother and as a devoted, um, you know, advocate and healthcare provider for women, particularly women of health and all women of health into this space. It's a needed conversation. And I'm sure that we will continue to bring you back on certain projects you're working on and really, to maybe kind of hone in on some of these things to really be mindful of. So I want to thank you so
Yes.
much. I want to
Thank you.
give you an opportunity to just speak to the audience there before we get ready to close out. Yeah, I'm just so excited.
Thank you so much, everyone. I could see the chat scrolling, but I couldn't read all of the comments. But thank you so much. Teaching is and empowering people to know about their bodies is really a passion of mine. So just the fact that you're listening and open to it is humbling. So thank you.
That I love that. And then before we go, I want to share everyone, if you're open to share, we can talk about how me and you connected. We won't go into all the details. Those who know, but we will talk about. Oh,
Um, so I stumbled across Miss Blue's YouTube channel last year around the Lionsgate portal, and she kind of had me hooked. And I was listening. I may have missed some shows here or there, but I was listening. Um, and she had gone live on Instagram a few months ago, and she was answering questions. And my father passed in
mm,
2010, and I've always had this connection where I can feel him and sense him and talk to him. He comes to me in my dreams, like he lets me know that he's there. And um leading up to the months leading up to this Instagram live, I wasn't feeling him so much. Like I was like, "Hey, where'd he go? what what happened?" um and so my question was simple. It was like, "Hey, is he still around? Like what's going on?" And he popped up and started sharing things with Miss Blue that I was like, I didn't ask that. I
all the
I
business.
I know what's going on over here. I wanted to know that you was still here, but I guess that was his way of proving to me that he is
Yeah.
here, and he's saying it all because he was spilling all my personal tea.
Yeah. Yeah, daddy came through and wanted to make sure that she knew for sure, without a shadow of a doubt, he was still with her. And yeah, we were kind of rocking after that. I teased Dr. Chris that her dad must have came through, it was talking to me, because afterwards I don't normally go and check my DMs, as y'all know, and especially where it is people who, you know how they say request to, or people are requesting to contact you that you don't follow or have a connection with. And I just heard that voice, go check, and I checked. I didn't even realize she was the same person I spoke to until we got on the phone. I looked and I said, wait a minute. She said, what? Pelvic health? Wait a minute. She's a doula? Oh, this is who I've been looking for. And then when we talked, she was like, yeah, Ms.Blue, you don't remember you gave me I said, oh, that was you. That was you, that your daddy came through and just told all the business. And we was laughing about that, but she has a wealth of knowledge, you guys, Dr. Kris, and I really want her to come back on. This is something that we don't talk about enough. Not to mention we live in a world and a culture where women were not even used during some of the medicine or the healthcare practices, because they just felt like our hormones made us so unstable. They really didn't, we're not included in some of these trials and tests that are going on. And so unless we have someone like Dr. Kris that really is an advocate working with women day by day and really have eyes and hands on to see what is going on in these areas, we really aren't getting accurate information. And they just now have started including women in clinical trials. We weren't included in these trials. And so it really makes a difference when you have someone who is as knowledgeable as you, as passionate as you, and really a visionary that can see a future to take us past and beyond of where we are, to educate us, to include us, and also to be there as an advocate and a support system. So I thank you so much, my intuitive sister. She don't know it yet, but she's a bad medium and a psychic too. So thank you so much, Dr. Kris. It's been a joy and a pleasure to have you join us.
Thank
here.
you so much. I appreciate you.
Yeah, you're welcome. So peace and love to you. So you guys, we're going to get ready to close out. What an amazing share. I hope you all are so full. I want to encourage you all to definitely let us keep this conversation going. And whether you're listening to this live, please pass it on, share it with others, particularly those who are in the childbirthing years, or even if they're not, just to kind of bring the awareness of women's health, particularly when it comes to pelvic health, how important that is, not just for women, children, and men. And just so many gems in here. And so let this be a reminder to us that the body is not simply something to manage. The body communicates with us. The body remembers, and the body creates. And when women receive information, they receive care, support that they deserve, right? Shame can become understanding, and fear can become preparation, and pain can become a doorway to even more and deeper healing. And so I want to thank Dr. Kris for reminding us of how powerful we truly are as the divine feminine on the planet, and as well as the significant role that fathers also play during this process that goes beyond just conception, and throughout the cycle. So I love you all so much. Don't forget to like and subscribe. And got to tell Dr. Kris to watch Brother Rich last night. Your tone was oh, I got to tell Dr. Kris to watch me on Brother Rich's show where I was last night. Yes, you guys got to go check that out. Had an amazing time with the brother Rich on Brother Rich's show as well. We had a powerful conversation. We're going to close out here. Keep the conversation going in the comment section. And I love you all so much. Peace and love, soul family. Peace and love. Ciao.